participation of the benefits of the people, the country at large, and a more sustainable management of the country's marine industry. Liberia joining this program was done through a memorandum of understanding signed between the National Fishery Authority, Agriculture Authority, NPHIL, headed by its acting Director General J. Sarah Sigmund, and the International Fishery and Transparency Program, FITI. This agreement establishes a collaboration framework to coordinate activities related to enhancing transparency of the fishery management in Liberia through the implementation of the standard set aside by FITI. The FITI standard is the only internationally recognized, organized framework that defines the information on marine fishery management, how it should be published online by national authorities. The objective is to contribute to the sustainability of the marine fishery sector by increasing availability, accessibility, credibility, and usable national fishery management information. The government of Liberia, through the Ministry of Posts and Telecommunication, in collaboration with C-Square Africa and other partners, has to officially launch the community Wi-Fi services in Bong and Lima counties. This initiative marked a significant step forward towards enhancing digital inclusion. The event is on the theme Gender Equality in Digital Transformation. The Ministry of Posts and Telecommunications said, together with private sector partners, the government is taking concrete steps to bridge the gender digital divide and empower more Latinos, especially women and youth, through connectivity. For new low-cost Wi-Fi access at health centers, schools, and community spaces, the government is actively working to enhance digital literacy and economic participation in underserved communities. This initiative reflects the commitment of the government of Liberia to ensure that every Liberian citizen can benefit and contribute to the digital transformation process of the country. That last day before we take Pastor Amma, the nation woke up to the news yesterday of the death of former First Lady NPHIL. So as a government, we announced that we profound sadness and deep sorrow. The government of Liberia has received news of the death of former First Lady and wife of former Liberian President Samuel Nancy B. Doe at age 76. Mrs. Doe served as First Lady from April 1980 to September 1990. Mrs. Doe will be remembered for the humanitarian role she played when she served as First Lady. While as First Lady and former market woman, Mrs. Doe was credited for ensuring the administration of President Doe constructed new market structures, including the extended Raritan market and Dwala market, and also the construction of several other markets, notably the H Street market named in her honor, the Nancy B. Doe Joplin market. She launched a scholarship program which assisted dozens of Liberians to pursue higher education in the United States of America. After her tenure as first lady, is a dual successful collaborator with past Liberian government starting in 1998 up to her death for national peace and harmony. As a government, convey condolences to the Dole family and we got a soul rest in peace. On that note, I now have the distinguished honor while I was in flight to witness the arrival of Dr. Brown from the National Public Health Institute of Liberia. We had initially announced that we're expecting him to be down here, so we'll take the medical people who are full medical issue concerns everybody. So Dr. Brown will speak first. After him, Councilor Hamman will follow. So he will speak, it's a health emergency, so he will speak. We'll take questions from you, and then he will leave. Then Councilor Hamman will speak to you on that first day for the non-presidency, how far we are, and the surety that we are starting from our international partners. And we will get the vote to have our country in there. Thank you very much. Thank you for the invitation to address the Liberian people and the world once again on the MPHIL situation in the country. In the last 72 hours, I was able to provide an update to the cabinet, the full cabinet, and also provide an update to the House plenary. Coming soon may be the Senate, and of course continuously we continue to speak to the press. We also had a press conference just last Sunday. MPOX, as the disease is called, is caused by monkeypox virus. The virus comes from animals and then it is transmitted to humans. So we call that zoonotic transmission, meaning a virus or any pathogen that comes from animals to humans. For MPOX, once you catch it, you begin to have symptoms like fever, headache, backache, your lymph nodes begin to swell, you sometimes have cough, and the most notable symptom is the rash. It's a typical rash that comes on your skin. It takes over your entire body, and you find out in the palms of your hands as well. In other places, symptoms include rashes around the genital area. Now, those rashes are in the form of what we commonly call bumps in Liberia. And those bumps are very, very big and large, and they are filled with pus. That pus is where those viruses are concentrated. That is why when someone has these symptoms and they lie down on a bed for some time, or they drink out of a particular towel, or they drink from a cup, or they touch certain surfaces, those viral particles are left in those places. And when you, who is a normal
quote-unquote normal healthy person comes into contact with these surfaces or the very person, then that's how they contract the virus. So the virus is mainly spread by contact, for which we give the regulations from the health and public health standpoint that when you see these symptoms on anybody, any of your family members, please do all of us the favor of not lying down beside that person or lying on the same bed the person lying on, taking out with the same towel, drinking from the same cup, or sitting in the same surface on the same surfaces that this person sat on. Report the case immediately to the nearest healthcare facility or to the National Public Health Institute using telephone number 4455. Because of interactivity and signal transmission, you will experience some because of the influx of calls. So when you are not going through a particular time, you should not worry or think that the number is not working. Because the call volumes are very huge now and they try to increase our capacity. On the current situation, this monkeypox virus outbreak was declared by the WHO and the Africa CDC, the Africa Centers for Disease Control and Prevention, as a public health emergency of international concern and security, respectively. And that was in August 2024. Prior to August 2024, Liberia has then responded to some sporadic mpox cases. So we have been dealing with this mpox situation since about 2020-2021. But it is as far back as 1970. The first time this virus was detected was in 1958 in DR Congo. What is now DR Congo? It used to be Zaire. Or back in 1958 it was Belgium Congo for the historians. And since then it has shown itself in various other countries, particularly in the West African forest. That is why you see the mpox virus circulating in our region, and the mpox disease has been one of those diseases that has shown its face. So, when I took over the NPHIL, immediately a few days after the outbreak was announced by the WHO and the Africa CDC, there and then we detected our first case. And that first case was detected in Sino, which we call our index case. That index case was a 7-year-old young girl whose father is, guess what, a hunter. And that's deep into the Sino forest in the district called, or in the area called Jidepo. And so you can see the correlation and the connection that we continue to draw, that this particular virus is a zoonotic virus, meaning it comes from animals. And that's how the father must have brought it in. The father was not sick, not infected, but the young little girl got infected. When she got infected, we were immediately notified and we started responding. Then later on, her mother also got infected because the mother is the one who always takes care of the child. We isolated that case and began treatment, which we call home-based isolated treatment. In the same time, around the same week, we got a call that in Lofa, another case of mpox, suspected case of mpox, was announced. So you can see how at two different ends of the country, we detected 2 cases. From that point, our cases began to be isolatedly cropping up. So we have this sporadic crop up of cases in various counties. Where we stand today is that what we have been doing is to continuously respond. Once the cases come up, we go ahead of the curve, isolate the case, treat the case using our isolated improvised management system, or we transfer that case to an isolation facility. In this work, we don't do it alone. We are public health responders. We work along with the Ministry of Health, which has all the hospitals for this care. And so, depending on the case gravity, depending on how severe the case is, we will isolate in a home-based treatment, which the NPHIL itself, along with other doctors and countries can do, or we do an isolation depending on the severity. Now,